Hi guys, how are you all? Welcome back to Ajiro YouTube channel. It's been a minute guys. It's been long since I uploaded a video. I've just seen it's been 3 months ago, okay? Yeah, so I went for a holiday, a short holiday in Kenya. It was raining, I had fun. Luckily, sikubebwa hatukushikwa na mkasa ya maji, but we're still praying for those people who got the problem, who are unlucky, and may God help us to be able to help where we can. Yes, and to remember them in our prayers. So I'm back. Welcome back to Ajiro YouTube channel. Today I'm gonna do a short video. It's evening. It's almost winter. Winter is coming, guys, and it's gonna be chilly. Right now it's 8:45 p.m. Yes. So today I thought of talking about 5 moments of hard hygiene in hospitals. Whether you're a nurse, whether you're a nurse assistant, whether you're a doctor, whether you're a doctor assistant, a theater assistant, a friend visiting a friend in hospital, family members, and name them all, whoever works in hospital. CEO, kama wewe ni CEO, kama wewe ni anesthetist, kama wewe ni mtu wa x-ray, name them all, ward clerk, au wote, those people who work in hospital. Guys, we need to know hard hygiene is very important. It's known to be very fundamental, especially in reducing infections in hospitals, or for patient especially. So hospitals, they have a lot of infections, guys. You can imagine all those people who go to hospital with different diseases, whether they are infections, whether they are other conditions. You can imagine. So these are 5 moments of hard hygiene. They are called moments. 1, we have, before you touch the patient, you need to do a hard hygiene. And what are we using? We have 2 types of things that I'm gonna give you. That is the normal one that we know, the general one that we know, even at home. We use soap and water. So apart from hospital, you also need to use soap and water, washing hands at home. So soap and water, it's known to reduce infection. I can't remember what percentage, but you remember during COVID? Yes. People are really emphasized or told how to use the soap and water to wash their hands for 20 seconds. 20 seconds, yes. So yes, so soap and water, and also the disinfectant, the sanitizer. So in hospital we have them, and even at our homes. After COVID, all of these things, they were brought up. Yeah. So yeah, so before you touch the patient, either you're gonna use, mostly in hospital there should be sanitizers. It's not always that you have to wash your hands with soap and water every time. No, that it's even not practical. So you use the sanitizer. So in our hospitals where I work, we have the sanitizers. So you just gel your hands and like that, and go see your patient. So that is one. Before you touch the patient, guys, you need to wash your hands. If you're a patient and you're watching this video, please know that you have a right to tell that nurse, to tell that doctor. And I have nothing against doctors, but doctors sana sana huwa wanakasirisha sana saa zingine. Huwa unaona daktari akona stethoscope, ameenda akaangalia mtoto kifua, alafu akaenda kwa mtoto mwingine, without even washing the hands, without even, daktari anafaa pia kupanguza hiyo stethoscope yake. So I have nothing against doctors, but kuna venye wanajionanga sana ati wao they carry a lot of that actually, I mean germs. Si ati uchafu ya nyumbani, they wear home clothes and the white coat, but those things carry infections. Yeah, so infection, you can't see it with your bare eyes. No, you can't. Anyway, so before you touch the patient, after you touch the patient, don't touch another patient without having to wash your hands, guys. You'll be spreading the infection. I know it's hard. It's sometimes you're busy, you doing what, and some patients, most of our patients, they don't know, or they fear doctors. If you are there and you're a patient, please, you have a voice. Use your voice. You have a right to speak. Tell them, and you can tell them nicely, I didn't see you washing your hands. Na huyo mtu atasikia aibu, lakini you will prevent yourself. Maybe they had touched someone who has a very contagious infection, and then if you talk to that person, you tell them, oh, I didn't see you washing your hands, and when they do just gel, the infection that was going to get to you or to be transmitted to you, it's gonna die. You're not gonna be having it, or it's not, that person, you'll prevent yourself, in short. So after you touch the patient, another thing, after a procedure, imagine a nurse akona catheter. Acha niseme hii ni catheter yangu, hii haifanyi kwa hii, this is my headphones, hazifanyi kwa hii simu yangu. So I hope you guys, I'm loud enough. So catheter, they're those ones wenye watu wenye maybe they have problems in urinating, ama alikuwa na theater, amewekewa hiyo mpira, watu in a layman language ni mpira, so iko na mkojo. So nurse amekuja, so even before you touch it, you need, before a procedure, so you sanitize your hands, and then you empty your urine, and then you when you go and empty the urine in the toilet or wherever, you have to wash your hands. It's also very important. Even if you had gloves, remove the gloves, because you can't do some procedures without the gloves. Remove the gloves and go wash your hands, please. So after a procedure and before a procedure, because if you don't wash your hands, maybe ulikuwa kwa mtu mwingine, and then you come touch this catheter, it can take those germs, and then take them to different, that bacteria, that virus, and then it's gonna go to patient's system. So haujasaidia huyo patient, hujamsaidia sana. You've emptied the urine, yes, that's good, but you've left that patient with a different infection or germs, bacteria, or virus, and maybe it's gonna be very hard to treat for that patient. Some patients are resistant to some medication. So before procedure and after procedure, and you can even get some those urine splashing on you, so make sure you wash your hands. And this time, after a procedure, if you soiled your hands, soiling meaning like maybe you are emptying, so with this picture, it's not about catheter only. Maybe you have colostomy bag, and then so you, of course, it's the poo-poo. So if you soil yourself, but it's very advisable you use soap and water. If you notice or if you sense like it was a lot of, or even after changing the diaper, and then use soap and water. So a sanitizer, the one for gel, it's when you're new, you know that it's just from maybe blood pressure check, maybe giving medications, but if you're sure you are doing a procedure that can make you have maybe the poo-poo, the splashing of urine, the splashing of blood somewhere, wash your hands using the soap and water with a running tap, running water. So we have 4. So before touching the patient, after touching the patient, before procedure, after procedure. And then the other one is after you touch the surroundings of the patient, maybe curtains, hizo vitu zimebeba hospital infection, maybe the bed, head of the bed or the foot of the bed, maybe when you touch the chairs around the patient. So those things, they have infection. So you, even after touching those blood pressure, the stethoscope, you need also to clean them before using it to another patient, on another patient. Okay guys, so if you have a question, talking to our moms there, our brothers and sisters, our dads, hata kama wewe ni wakule, nilisema hii YouTube channel we are learning, all of us. If you are at home, wewe uko pale mashinani, you're going to visit someone in the hospital, remember to do hand washing. Remember, even you're in a hospital and they haven't provided the sanitizers or soap and water, ask. That's the one thing that hospital should not lack. Ulizia, ama ukuwe na ile sabuni yako and wash your hands just to prevent that young one at home. Imagine ukitoka hosi and you haven't, if you're going to visit a patient in the hospital, remember, 100%, or the possibility is that you've touched the environment, the surrounding environment, the doors, the curtains, the chairs, the patient. So make sure you wash your hands before going home and even before seeing that patient. All right, guys? Even if you're taking care of that patient at home, it's very okay, or it's a good idea to remember to wash your hands, because you have a patient at home, you have to cook, so you'll transfer your infection from the patient to the food. And who's gonna get sick next? You. And we don't want you to be sick, because you're doing a good job taking care of that patient, taking care of that loved one. So yeah, so that's my video for today. I'll try and keep up with posting videos, because this is where we can learn. Yeah, and thank you everyone for listening to me. Please subscribe to my YouTube channel. It's very new. I have 17 subscribers, guys, and I feel good. I feel so good. But please, if you feel that it is very important, it is helpful, please subscribe. Thank you guys. Bye. Have a good night. Have a good day. Have a good evening, wherever you're watching me from.